Thanks. Well, and as noted, this meeting is being recorded. So I did see, just saw a question in the box, in the chat box around that. So we will have this information that's available. Good afternoon. Good to see everyone. As I look across the screen, I see some new names and faces and some familiar ones. So we appreciate each of you making some time to spend with us today around the Emergency Solutions Grant and around the path forward around this. We know that your plates are full. There's a lot happening across the state. And so we appreciate you making some time with us today. So as Sam mentioned, my name is Andrea Bell. I'm the Director of Housing Stabilization here at OHCS. I know that some of you may or have a past in directly working with us, and some of you may have not. So just for a little bit of context and introduction about who we are. So Oregon Housing and Community Services is the state's housing finance agency. We also serve as a leader in addressing and preventing homelessness. Across the work that we do, we have three main program divisions here in the agency. And so we have our affordable rental housing division, which really focuses on increasing the production of affordable rental housing and is also where our permanent supportive housing work happens. We have our home ownership program, in which really lead a lot of our work regarding connectivity to home ownership and our manufactured housing programs. And then from today, you are hearing from the homeless services team, which is part of the housing stabilization division. So think of this division as the community services arm within OHCS. The vast majority of the funding that we receive, both state and federal, are directly allocated to our community action agencies across the state. There are 18 of them. And so you may be wondering, hearing that, sort of, why are we talking about a competitive granting process? And so we'll talk a little bit more about how we got here, but I just also want to set a little bit of broad context here. Is within our statewide housing plan, and particularly over the last handful of months as we've all been responding to crisis, we've been all really thinking about the ways where we can show up more authentically and have more actionable intent around leading with race and serving our tribes and communities of color. We didn't get here in this moment by accident. It was very intentional that we created and sought this opportunity in which we can really increase capacity of our service providers across the state and be more inclusive in the way we do that to really ensure that we are including our culturally specific service providers. And so as we go through this today, I just want to highlight that this is a historic moment in time, not only because of the crisis, but because we have this new way of showing up. We have this new way of investing these really critical dollars. I think we all can agree that it is important in this moment in time that we pursue actions that match the scale of the crises and get creative about the way that we do this work. And so as Sam mentioned, we encourage everyone to use the chat function, to put out questions, to put out ideas that you may have for us, or things that any information that you need. And so we'll use this time to go through sort of, again, kind of broad context around this program and around the RFA competitive process. And so we're glad to be with you today. Again, aggressively use that chat function if you have any items for us. And with that, I will turn it over to Assistant Director Savara to start us off.
Thank you, Director Bell. So I'm just going to cover a little bit of background about kind of how we got here, some context on the ESG program at large, and then some of my colleagues are going to get into some of the more sort of in the weeds details about exactly what the program can fund. So ESG stands for Emergency Solutions Grant. It's a federal program from the Department of Housing and Urban Development, and it's kind of got an interesting history. It's really it used to be called the Emergency Shelters Grant, and it was really focused on helping support communities with their sheltering needs for people experiencing homelessness. About 10 years ago, it changed names in reflection of the need to really focus on helping folks experiencing homelessness get a rapid transition back into housing and support people quickly exit their homelessness and then be able to maintain their housing from then on. So it has a variety of uses, but I really like to think about ESG as a systems approach. So it really can support people from that point of first contact where they're experiencing homelessness out on the streets, and they run into a street outreach worker who tells them a little bit about some of the services that are available in the community, all the way up to emergency shelter and supporting someone just kind of getting in off the streets and staying safe and warm. And then on to supportive services while they're able to maintain their housing and ensure that they have the necessary rental assistance to prevent them from becoming homeless again. So it really covers that continuum for a person who's going through a bout of homelessness. It's important to mention that ESG is an entitlement program. So the state receives this directly from the federal government, from HUD. And then we also have certain jurisdictions across the state that receive their own allocations from HUD directly. So there's definitely an important overlap with our coordinated or continuums of care, the COCs across the state, because the ESG is really meant to be a collaborative funding source to make sure that COCs are involved in helping guide the use of these funds. I'm going to go to the next slide. So on to kind of the current moment, thinking about where this unique pot of funds, the ESG CV or COVID dollars, comes from. So because of the need to respond both to the pandemic, the public health effects of the pandemic, as well as the financial repercussions of the pandemic, in March, the CARES Act was passed at the federal level. So the CARES Act had a bunch of provisions that really provided a means of supporting different communities through their recovery and response efforts. And one of those was an additional allocation of about $4 billion of ESG CD dollars. So HUD received this as a national allocation, so go out through a formula process to throughout the country. And this was really meant to respond to the effects of the pandemic on people experiencing homelessness. So there's a wide variety of different reasons and rationale for why people experiencing homelessness are a huge risk, both for getting the virus themselves, but also because of the fact that many folks experiencing homelessness have poor health outcomes. The ramifications of them getting COVID is pretty dire. So it's so important that we have our systems and our health systems, our public health systems, as well as our housing and homelessness systems aligned to make sure that this population is protected and that we have a response to the crisis that's at hand, that's really thinking about our most vulnerable neighbors living outside. So ESG-CV came from HUD in a couple different waves. It actually came in a first wave we call phase 1. That was a $6.7 million allocation to the state, and that allocation was given directly to the community action agencies by formula. So that's because of the statute, we were able to quickly get those dollars out on the streets, and those are currently being used for a variety of needs, including winter sheltering, as well as homelessness prevention and other resources to make sure that the communities across the state have access to those resources. Phase 2 is a $49.4 million allocation, and of that amount, $7 million is going to the community action agencies, because OHCS sought and received some flexibility in our allocation process to go outside of the community action agency network and utilize a competitive process to ensure that we're able to fund different community-based organizations and really broaden the table, if you will, to make sure that folks are able to have access to services and resources in their communities. Often folks experiencing homelessness are really interacting with different systems and need different resources. So really wanting to make sure that we have culturally specific providers at the table, culturally relevant providers at the table, as well as other community-based organizations that are doing excellent work in providing response to folks experiencing homelessness. So this is sort of where we're at right now in the moment. The reason you're here today is because of this RFA process. So we're going to go into a little bit more detail later on about sort of our timeline and process for the RFA. So if you have questions, feel free to drop those in the chat and we can address those later on. But for now, I think this is kind of the most important kind of elements of the process, kind of how we got to where we are. I'm going to kick it over to my colleague, Vicki, who's going to cover a little bit more about some of the program allowables.
Good afternoon, everybody. if you've worked with the ESG program, you know that there are 6 components to it. There are the same 6 components to ESG CV, but HUD has issued a number of waivers that change some of the pieces of the components. So just be aware that if you go to the federal rule or you read other information about ESG, it may be in conflict with something you read about ESG CV. So you want to always follow the information for ESG CV. The slide shows 5 components, but the 6th one is admin. You are entitled to 5% of your allocation or your award to be admin. And then after that, homeless management information system is going to be a requirement. Hunter will talk about that later. But just so you know, you will be required to provide data on the engagements, the services that you provide. Then starting with number 1, there's a component called street outreach. And this is identifying, engaging with folks that are unsheltered on the street, seeing what they need, what they want, and laying the groundwork for a relationship with those people. And then the second is emergency shelter. And this can actually take a couple of directions because HUD has allowed kind of a splinter shelter called temporary emergency shelter. This is for this COVID period only. And the shelter can be provided until January 31 of 2022. And then any funds that you have for any ESG CV funds that you have for the temporary emergency shelter that you haven't spent, you would need to switch to some other activity. But then there is the regular emergency shelter also. And it's composed of 2 pieces, which are the operation costs. So ESG CV can cover rent of the building, payment of the electric bill, food for your clients, bedding, anything you need to operate that shelter. And it can also pay for essential services, which would be your case management, helping to find someone a unit to rent, those kinds of services. The third one is homeless prevention. This is a service that you would provide to somebody so that they don't lose their housing. So it's it can be a mediation service with their landlord. It can be paying back rent. A number of services to help them stay where they are, or to relocate. If they need to do that, they're in a unit, they're going to be evicted, their landlord doesn't like them, and they need to find other housing. That would come under homeless prevention too. The fourth is rapid rehousing, which is used for people who are homeless, technically homeless, and you want to rehouse them as soon as possible rather than put them in a shelter where the chances are they will just cycle in and cycle out of the shelter. If you can rapidly rehouse them into permanent housing, they become stable that much faster. And we use the model of Housing First for rapid rehousing. I think that's it. We're going to go into other slides that will go into some of these items deeper as we go along. Thanks.
Great, thank you, Vicki. So next, we're going to cover a little bit about one of the really unique things about this fund source as compared to regular ESG allocations. So I think one of the most important things to mention about this fund is that it's really meant to respond to the coronavirus pandemic. So in the language for the appropriation, you'll see the mention here that ESG funds, ESG CV funds are to prevent, prepare for, and respond to coronavirus. So it's really designed to make sure that we're using this as a public health intervention, if you will. So the prevent, prepare, and respond, those don't all have to show up in each program, but you have to have one of those represented for every program, for every activity you're doing. So a good example would be if you're providing street outreach services, that may be in part to educate and provide hygiene or supplies to folks so that they have the ability to wash their hands or use hand sanitizer to make sure that they can stay safe while they're living outside. Or maybe you're using an emergency shelter, a non-congregate emergency shelter to prevent folks from ever getting the coronavirus in the first place, because you're able to get them away from a congregate environment and they're able to stay off the streets and stay safe. So it's really important that every activity, every program that you're thinking of, that there's a connection to that coronavirus response, whether that's preventing, preparing for, or responding. So that's a really critical piece to think through. I already mentioned that this is a pretty large allocation from HUD across the nation of $4 billion. And then in terms of timeline, I think it's important to kind of think through like the program length here. So really, this is really designed to respond to the coronavirus pandemic. So the program timeline is until September 30th of 2022. That being said, there are certain parts of the funding that will end sooner. So Vicki mentioned temporary emergency shelter. That's in January 31st, 2022. So all program activities for that category have to end by that date unless we request and receive a waiver from HUD. Also, that September 30th date could be, we're likely to set a date that's sooner than that September 30th date. Tentatively right now, we're looking at June 30th of 2022. So it's important to make sure that you're planning your timelines in terms of your spending, in terms of the cost to operate your programs, sort of with that in mind. And when we release the RFA, we're going to have sort of our finalized dates in there that you'll see exactly the timelines that are outlined there. ESGC programs are also, there's additional information through a couple sources. So the ESG program guidance, that's in statute under the regulations here, 24 CFR 576. There's a lot of information there. One of the important things Vicki mentioned is that those regulations don't incorporate the changes and the modifications that HUD has made under the ESG CV program. So in order to get information specifically about ESG CV, you're going to have to get the additional guidance that HUD has issued. And so there's a few waves of notices and waivers that HUD has issued at this point. And it's really important, we're definitely going to be providing ongoing updates to grantees in this program, because we're fully anticipating additional changes and modifications to the program from HUD. And as those changes happen, we're going to be communicating with grantees to make sure that they're aware of those changes. The next slide. So a couple other things we wanted to mention about some of the additional flexibilities that we've seen so far from HUD is really thinking about the temporary emergency shelter. Vicki already outlined sort of this unique aspect of the temporary emergency shelter program. So a good example of this is if you wanted to operate a motel hotel voucher shelter, basically putting folks into motels and hotels to run a non-congregate shelter, it may fall under a temporary emergency shelter part of the fund. another great example is that we've seen folks look at sort of unique options, things like pallet shelters or Conestoga huts. It's possible, depending on the habitability standards for the particular product that you're using, that you could use ESG to purchase temporary emergency shelters in the form of those sorts of freestanding structures that allow for one to set up a shelter in a really short period of time as a response to the pandemic. So another really important change that ESGCB made here is that they allow you for the first time to purchase real property up to $2.5 million per project. So that means that if you wanted to, you could purchase a hotel or a building for operating an emergency shelter up to $2.5 million. There's a lot of caveats there that I think it'll be important to outline, and we're going to provide some additional information about sort of the different aspects of operating and using that new flexibility, and definitely look for more information on that. And if you have additional questions about sort of some of the specifics about temporary emergency shelter, we're happy to answer those, or also questions about purchasing real property under this fund. Some additional things is training. So operating training and giving information to folks is really important during the pandemic. So that is an allowable cost, and it's not a cost that you would have to incur under your admin amount. You could actually run it as a program that you're offering to, for instance, staff or clients, to make sure that they're aware of the need to do social distancing and the importance of wearing masks, and sort of the hard facts about the response to the coronavirus. Hazard pay is an allowable cost, hand washing stations and portable bathrooms. It's so important now more than ever to make sure that folks living outside have adequate access to hygiene, and making sure that they have the ability to do hand washing and sort of make sure that they have that level of dignity and safety that's necessary. Landlord incentives to really help landlords feel more confident about taking on maybe someone who's a little bit more risky, who has maybe some history on their backgrounds that makes the landlord a little nervous. Well, landlord incentives could help to make sure that you're sort of mitigating those risks for them. Additionally, volunteer incentives. Recognize that previously our shelter systems often relied heavily on volunteers to make sure that the programs were able to operate, especially winter shelter, providing incentives to make sure that volunteers have a little bit more sort of compensation, if you will, to make sure that they're able to staff shelters or provide those additional services. Really important. With that, I'm going to pass it over to Hunter, who's going to go into a little bit more about the HMIS and data collection requirements.
Thanks, Mike. Everyone's favorite topic, data entry into an HMIS. Woohoo! This slide, honestly, it's kind of, this is a little interesting. This slide is really designed for maybe an agency that doesn't know HMIS. And as I see the participant list, many of you are not in that group. Some of you are continuum of care leads and are very, very well versed in HMIS. So I'll try and kind of go from maybe not having to maybe some changes for those of you that do have HMIS. Again, maybe I'm going to start with, I'm an agency. I've never kind of done this before, or I'm certainly providing some really good services. I've never gone for OHCS money, so I've never been required to enter data into an HMIS. As Vicki said, if you are getting this money, you have no choice. You have to put your data into an HMIS, unless you are a victim service provider, and then you have a different path. But if you're not a victim service provider, you are going to be using an HMIS for this. So the easy one, again, I'm not versed in HMIS. The easy one, you have to be kind of a nonprofit or a local government entity. So you have to, go through that process first. You're deemed that, then you start working towards getting into an HMIS. Oh, well, how would I get access to an HMIS? Do I just, call someone and say, hey, give me HMIS access, and they say yes? Really, you have to go through your continuum of care. Why is continuum of care even in this conversation? Where is this money coming from? It's coming from HUD, Very much like OHCS, we have multiple funding streams. HUD is no different. HUD manages the continuum of care competitive funding stream program and ESG. So how do you report to HUD around your ESG? Through an HMIS. So how do I get connected? Well, since continuum of cares are required to use an HMIS to be a continuum of care, I can't be a continuum of care if I don't have a direct connection to an HMIS. You go through your continuum of care to get connected to an HMIS. It also pulls you into this word collaborate. You know, it's right on the slide. It says, well, you're going to collaborate with your regional continuum of care. You're collaborating to get access to an HMIS so you can do the reporting that you need. You're also collaborating because continuum of care, if you're not familiar with continuum of care, it is competitive. It's HUD competitive process, and it's incredibly competitive, and you're trying to get a score on your community's homeless system. They're called the system performance measures. So if you're an agency that's coming in and saying, I want to get some ESG CV, maybe to do like a temporary shelter, you immediately become a part of your continuum of care's system. When we talk about continuum of care systems, of course, we use the word coordinated entry. Oh yeah, coordinated entry. That process is required for continuum of cares. So when we're talking about shelter, we normally always talk about coordinated entry. The people in your shelter, are they connected to this coordinated entry process that's happening in your community to maybe connect them to a housing opportunity? So you will be connected, and you'll definitely collaborate with your continuum of care if you're going to provide some of these wonderful services that are allowable with ESG. Okay, so now I'm connected. So maybe again, I've never been connected before. Now I am connected to an HMIS. What's a little bit different? Now I'm kind of talking to everyone, even those of you that are using HMIS and have been using HMIS for years and years and years. First and foremost, your reporting requirement for ESG is annual. Okay, every year I'm going to submit the required report. And that required report, it's called a CAPER, the Consolidated Annual Performance Evaluation Report, or something of that nature. The CAPER is uploaded into HUD's reporting platform or program called SAGE, which again, many of you on this call are very familiar with that process because you're also uploading reports for your continuum of care reporting. So that process, I'm going to run a CAPER. Again, normally it's annual. For ESG CV, it is quarterly. You are going to be running these reports, the CAPER, that creates a CSV, comma separated value, and thankfully your HMIS does that for you. You're going to be running these reports quarterly. Also, since I do see some very HMIS lead level people, what we call right in ESG, OHCS is the recipient of the funds, and most of you kind of trying to get the money, you're sub-recipients. Most regular ESG, the sub-recipients, you upload your own report into SAGE. You're the sub-recipient, it's my program. For this program, the sub-recipient, you don't upload your own report. What? If I don't upload it, who does? Your HMIS lead bundles those reports. So you used to do it individually. Oh, I'm an ESG recipient. I'm just going to do my one CAPER and upload it. Your HMIS lead is bundling that data for you and uploading it. So again, a little bit different process here. Just one other thing around kind of ESG, some differences. We mentioned the word street outreach. Street outreach, a really, really good program for ESG. If you are doing some street outreach, you have a very, very distinct workflow in your HMIS. And one of the distinct workflows for street outreach, it's called date of engagement. And it's very possible you have not seen or heard of that. I don't use the date of engagement in my rapid rehousing, in my emergency shelter programs. Well, for ESG, if you're going to do street outreach, you're going to be using date of engagement. So it's just the intent, and this is kind of the theme of this slide, reporting to HUD through SAGE and the CAPER for ESG. It's quite intense. It's very rigid. You don't get a lot of flexibility. When OHCS is the funder, when it's our money, we're allowed to be a little bit more flexible on the reporting. When we're talking about ESG, we don't get that flexibility. It's not our money, we're the recipient. So it's very, very detailed and rigid. So you just want to make sure you're totally dialed in. Again, whether you're brand new and you need access to an HMIS, or you've been using an HMIS forever, and you just need to know the little differences with ESG-CV. I'm here to help. Any questions you have on HMIS, the CAPER, anything of that nature. Again, I mentioned victim service providers. Well, what report would they submit? It's also a CAPER. It's different. Any questions you have, I'm here to answer and provide as much as I possibly can.
Thanks, Hunter. It's always hard to follow up after Hunter does his little presentation because it's so animated, but I'll do my best. Just a little bit of an update around our RFA process and timeline. And so as many of my colleagues have mentioned already, we have $42.4 million that we are allocating as a competitive process. What we have come to a conclusion with our procurement partners is that we are packaging this in a request for application, which is the RFA acronym that you see. So those of you who are interested in becoming new grantees of these funds are likely most interested in our November through February timeline here. What we're doing currently is finalizing this RFA and making sure we get Department of Justice approval. In early November, we will be posting that RFA publicly for approximately 30 days. So there will be a month time frame of application posting through application closure. Right around the time we release the RFA publicly, we will also be holding a series of RFA pre-application webinars. This is where potential grantees or potential applicants will have the opportunity to engage with us around the very specifics of the application process itself. How do I apply? Where do I find the application? Am I eligible? What activities are recommended? How do I write this particular statement? All of those kinds of questions are going to be packaged in that pre-application webinar element. So today's webinar is focused primarily on ESG, Emergency Solutions Grant program work. The pre-application webinar in early November will be very specific to the application protocol and the application process itself. And then as you see, from late November through January or February, that is when we will be internally reviewing and evaluating all of those RFAs and noticing grantees for awards. We have a deadline of February 18th of 2021 to allocate funds. So it's a tight time frame, but this is an approximate measure of what you can expect over the next handful of months. One other thing that is not on this table, but is something that we are intending and planning and committed to doing, is having a pre-award series of engagements where any new grantees, any current or existing grantees, anyone that is interested in understanding how they can best onboard these grants to ensure their success and implementation will be invited to those as well. And that's an opportunity for new grantees, current and existing grantees to interface with the Homeless Services team, our fiscal and accounting team, and also our procurement team on what they need to do to be most successful. And I'm going to kick it back to Sam, who's doing the next slide.
Great, thanks, Laura. And I will try to be quick because I know we're going through time here and I see tons of great questions coming into the chat. And so we want to make sure we have time at the end to get to as many of those as we can. So please continue to ask them. So far we've kind of learned a little bit about ESG, the history surrounding ESG, the funding process, what some of the specifics are for ESG and ESG COVID. as well as some of the federal requirements. So for a lot of you, as Hunter was noting, this is very much information that you are well aware of. For others, no doubt this is a lot of new information. So thanks for hanging in there. And I also want to take a few moments to try to connect a few dots around what the fund source allows, kind of what the COVID moment demands, and where, based on several factors, OHCS has our priorities. One of the questions in the chat, I think, was around that. And so I think hopefully this will speak to that a little bit. So as has been noted today, COVID-19 is really not an equalizer, and we know that communities of color are disproportionately impacted by both the virus and the economic turmoil. So our focus is really on responsibly and constructively serving all communities and targeting communities hardest hit by COVID. So with that in mind, and specifically the HUD guidance around preparing, preventing, and responding to coronavirus, we have outlined several priorities. So the first one is really reimagining and strengthening Oregon's shelter system under a non-congregate framework. So recognizing that COVID will continue to be with us through the winter warming season, and that congregate shelter is just not ideal, probably ever, but certainly not during a pandemic. So we would really like to try to use ESG to focus on emergency and temporary shelter as HUD allowable activities. So ultimately it's about keeping people safe, warm, and properly socially distanced during COVID. But beyond that, we are also interested in supporting projects that not only meet short-term needs, but also shift the shelter system in meaningful ways in the long run. So thinking about building system and infrastructure improvements. One of the questions that came through I saw was around non-congregate specifically. So there are a lot of different definitions around non-congregate shelter. And I want to be clear up front that we're sort of using that as a blanket term, but it's non-congregate, it's safe social distancing, and different shelters may look different in communities throughout the state. So it's not specific to one definition, but it's more around like, how are you responding to the coronavirus pandemic? Secondly, meet the goals or meet the needs of Oregon's unsheltered and high needs populations first. So really recognizing that there have been significant rent relief investments by the legislature using coronavirus relief funds, and that those programs still continue to serve folks to prevent homelessness. Obviously, these aren't enough, but they are out there right now. So we want these ESG CV2 resources to focus on people with the highest immediate needs. So people experiencing unsheltered homelessness, people seeking shelter, people with high comorbidities or higher risk of suffering consequences from COVID. So practically speaking, in terms of ESG allowable activities, this means, again, investing in emergency shelter, temporary shelter, and street outreach, and in particular, street outreach that leads with culturally specific and responsive services. Third, incorporating culturally specific organizations to expand the homeless service system network. So this has already been discussed several times today, so I won't belabor the point too much, but this is really one of the reasons why we're so pleased to see all of you here today, is really that recognition that overall, different organizations provide services in different ways, and the continuum of care, the continuum of services to serve people experiencing homelessness is stronger when there are more seats at the table. So this is really about calling in additional organizations, not pushing anybody out. And then fourth, utilizing a housing first approach to connect households to permanent housing. So this is really recognizing that shelter, even great non-congregate, safe social distance shelter, should be short and temporary. That's not the solution, and that's not what we want to the end goal to be for people experiencing homelessness right now. So it's really critical to use part of these resources to support people moving into permanent housing. So to do this effectively, we really need to leverage other available permanent supportive housing resources by at least our federal partners and other federal partners. So I think a few other tenets that are sort of within all of these goals, and one primarily is collaboration and coordination. And as Hunter touched on very well, this is really about supporting and improving the systems of care that already exist to serve people experiencing homelessness. So we are really looking to not only have these goals, but also find folks who are willing to collaborate with other organizations already doing the work in their communities. And then additionally, as Vicki noted, homelessness prevention is one of the goals, one of the allowable activities by ESG. However, we are less focused on homelessness prevention with this specific pot of funds, especially given the COVID pandemic, the other resources dedicated to homelessness prevention, and the real need out there on the ground right now. So that's kind of a very high level overview of some of our state priorities. So with that, I'm going to turn it back over to Laura to round us out.
Just really quick, we do understand, oh,
We're muted.
you're good now. I'm good now. Okay, sorry, I was talking while I was on mute. Thank you, Sam. I'm going to make this really, really quick, knowing we're crunched for time, but we recognize that many of you may or may not have been grantees of our programs in the past or currently. And so we really want to ensure that we provide as smooth of a landing for onboarding, technical assistance, and support for all of you as possible, which is also why we're kind of hammering home some of those interim opportunities for engagement.
And then just to kind of round out the message here, it's really important to think about partnerships between different organizations. Homelessness is an extremely complex phenomenon, and it's driven by so many different factors, including systemic racism, healthcare inequity, and housing instability. And we know that there's no one answer, no one organization that can do all of this work. So we are just wanting to flag this and keep this in the kind of the front of your minds, that partnerships and collaborations are going to be really the key to making sure that these funds are used most effectively, especially to reach folks that have historically not had the greatest outcomes, who have not been prioritized, communities of color, tribal populations. It really is so important to make sure that we're building access and equity in our homeless system. And we're hoping to do that using this competitive process. So just keep that in mind as you move through your sort of pre-application thoughts and thinking through what your next steps are. And I think with that, we are moving on to Sam.
Great, thanks, Mike and everyone. So appreciate everyone's attention diving through a mountain of content. So sometimes I think that's the best way to describe the Emergency Solutions Grant Program is a mountain of content. So it takes a lot to get through. It takes a lot to learn. If you are new to it, you can certainly learn that and we can help you do it. And if you are experienced with it, please reach out to the folks in your community who may not be. I think this is really a critical opportunity to really continue to build our system. So with that, there's been lots of great questions pouring in. We've been doing our best to sort of gather them as we go. And I'm going to kick a few questions over to folks right now. So starting with some very specific program questions. We received two around eligibility. So the first is what HUD homeless categories are eligible, just homeless category, people experiencing homelessness definition number 1. And then the follow-up question is, are undocumented or mixed documentation status families eligible? So I will kick that over to Vicki and Mike.
The HUD homeless definition is what ESG is built on, and it hasn't changed for the ESG CV. All of the 4 components of the homeless definition are eligible for funding.
And then just to kind of chat through the undocumented question. So folks who are undocumented are eligible to be served using ESG program funds. There's a couple of sort of ways that happens. So it's really important to kind of look at the details, but I think I'll just say yes. And in general, nonprofits, charitable nonprofit organizations are not required to inquire about someone's documentation status. And because of that, they are able to serve folks regardless of their documentation status. So a couple more caveats there, but I think that's probably the short answer there.
Great, thanks, Mike and Vicki. And again, we'll follow up with these in written form with some detail and some clarity. So with that, Laura, we have a couple of questions around timeline. When do funds get distributed or are available for reimbursements, as well as won't this timeline make it difficult to fund winter shelter?
Thanks, Sam. The actual money will be allocated by February 18th of 2021. I think I might have said 2020 before, so I apologize if I'm mistaking my years, but February 18th of 2021 is our final allocation date, so by end of February. And that's a really good question about winter shelter. So we understand that this time frame of the competitive process takes up a tremendous amount of those months of actual what we would consider winter here in Oregon. The one thing that is really critical to us in this opportunity of statute or statutory authority to allocate these funds to culturally specific and culturally responsive organizations is the fact that we need to balance moving these monies quickly with the fact that we have a disproportionate income of COVID on our communities of color. And we do not have adequate or appropriate services in our system currently that we fund that ensure the safety and the health disparity gap is closed for those communities of color. So it is a balance, it's a careful balance in this competitive process around ensuring that we are leading with race and that we have race at the center in the decisions that we are making around who we will fund competitively, and also that there is adequate time to do planning for those particular resources. The one thing I will say about this coming winter, there are already resources out in those community action agencies that can be used for the 2020-2021 winter season. We also are in process of allocating some discretionary funds and other pots of money from other programs to kick out to our community action agencies for the purpose of supplanting or supplementing those winter shelter dollars or other programmatic dollars. ESG CV1 or Wave 1, the $6.7 million is already out and on the ground. So there are some resources currently available to our network partners who are able to prepare for those kind of first months of the winter while we run our competitive process for ESG CV2.
Thank you, Laura. So we've received several questions as well around connecting with HMIS, around if you are a new shelter, what does that look like for you, as well as connection to your continuum of care and who can apply directly to these funds. Starting from the back, moving forward, I would just say that folks are allowed to apply for these funds directly, but they are also allowed to apply collaboratively. So we, in all of our discussion around collaboration and recognition of the continuums of care at the system level, applying collaboratively is a fantastic opportunity, but we're not removing the possibility that folks can apply directly for these funds through the RFA process. The other questions regarding how to connect with your continuum of care and what it looks like for a new shelter and HMIS, I'm going to kick it over to our HMIS administrator, Hunter Belgard.
Thanks, Sam. Good questions, you guys. The continuum of cares, they're geographically determined, so it depends where your agency is located. I think one of the questions came from Leah, and Leah is in Portland, Oregon. And in Portland, Oregon, the Joint Office of Homeless Services is the entity that manages the continuum of care for Portland. So that's who you would contact, and that's who you would get in touch with. If you don't know, like, oh, well, I'm in a different region, you can email me directly. I'll get you connected to the right people. It's also searchable on Google. There is a website, it's called HUD HDX, or the data exchange, as we like to call it. And actually you can find who your kind of continuum of care, like HMIS contact is. But if you're like me, Google searching is no fun. So you're more than welcome to reach out to me directly, and I can I can introduce you to that person. It's geographically based, and the continuum of care, they all have different processes of how you access HMIS. So it's the continuum of care that decides how you kind of get into their realm. And I'll put my email address right now, you guys.
Thanks, Hunter. Appreciate that. And I see some other folks from the continuums of care putting their email addresses to share a way to get in contact with them as well. So one of the questions that came through was, how do we connect with the Continuum of Cares, or what we are doing to connect folks in their regions to their continuums of cares? And I would say that this is part of it. This is somewhat new for us as well, as we've talked about throughout this process, thinking in this RFA and competitive process and a collaborative application. So we are hoping and relying on you as well to continue to share your information and continue these discussions in your specific communities. So certainly willing and open to hear other ideas about what would be helpful or additional information that you need. I'm looking through my list of questions here. Okay, so we have another question specifically about subrecipients, and I think I might kick this over to Vicki and Mike. Can we subcontract with our community action agency to do the HMIS data entry and reporting?
Yeah, that's a great question. Absolutely. Those are the kind of partnerships and collaborations that I think we're anticipating and encouraging. You know, if a community action agency, you know, just thinking about the previous conversation about HMIS and the COCs, if your community action agency has a lot of capacity for data entry and making sure that those processes are in place, working together and maybe collaborating on an application or subcontracting out that work is absolutely an allowable process. So we're definitely anticipating these partnerships. I saw another question or comment about culturally specific organizations. Maybe some of them are smaller. Maybe some of them haven't had a lot of experience with ESG or federal funds in particular. We understand that. We're really wanting to make sure that we're able to link the organizations that need extra support or extra resources to make sure that they're able to operate these programs and do that amazing work they're doing. We want to see those kinds of partnerships in place. So absolutely.
Thanks, Mike. And so we're coming up on 2 minutes left here. So I will just say that we're about out of time for today, but hopefully the questions and the conversations will continue after this. So I'm going to put a link to a survey in the chat, and we would really appreciate it if you take a few minutes to fill it out. It's just 2 questions, trying to understand what more you need, what information would be beneficial for you all moving forward. And really appreciate all the continuums of care sharing their information in the chat as well. So thanks everyone for joining us today. Really appreciate it. I know many of you probably have to jump on a 3 p.m. Zoom call. I think with that, we will close our webinar, but we look forward to the RFA coming out in the public notice, and we'll make sure and share that information along with the slides, the recording of the webinar, and the FAQ to everyone's email who registered for this webinar. So once again, thank you all, and we look forward to talking soon.